Good afternoon, everyone. I'm Nirav Shah, the Director of Maine Center for Disease Control and Prevention. I'm joined this afternoon by Governor Janet Mills and Commissioner Jeanne Lambrew from Maine's Department of Health and Human Services. Governor Mills, Commissioner Lambrew, and I are delighted to be able to spend some time with you this afternoon talking about where we are with respect to our work around COVID-19 across the state of Maine for today, Thursday, February 4th, 2021. I'll start out by providing a public health and epidemiological update and then turn things over to Governor Mills. I begin my update on a sad and somber note. Maine CDC is reporting the deaths of 3 additional Maine people today. Those deaths include 1 resident of Kennebec County, 1 resident of Washington County, and 1 resident of York County. 2 of the people who died were women, and 1 was a man. 1 of the people who died was in their 70s, and 2 were in their 80s and over. The deaths that I am reporting today come on top of 10 additional deaths that Maine CDC reported yesterday. Of those 10 deaths reported yesterday, 8 of which were from our review of vital records, a process that I discussed earlier in the week. All told, these deaths bring the total number of people in Maine who have died with COVID-19 now to 630. We would like to take a moment to offer our deepest condolences to the family members, friends, and communities of all of the individuals in Maine who have died with COVID-19 just in the past year alone. Right now in Maine, there are a total of 40,534 cases of COVID-19. Of those, 32,537 are confirmed cases and 7,997 are probable cases. In terms of hospitalizations, since we logged our first case, 1,420 people have now been hospitalized with COVID-19. Of those, 249 have been hospitalized just in the past 30 days alone. Right now in Maine, 145 people are in the hospital with COVID-19. 46 of them are in the intensive care unit, and 22 of them are on a ventilator. Turning now to some updates on outbreak investigations. There are 4 outbreak investigations that I wanted to note that Maine CDC has opened just in the past 48 hours. One of which is at the Glen Ridge Rehabilitation and Long-Term Care Facility here in Augusta, where we are aware of 10 cases. Yesterday, we opened an outbreak investigation into the Harbour Hill Center in Belfast, where we are aware of 4 cases. Yesterday, we also opened an investigation into the Home, Hope, and Healing entity, where we have seen 8 cases of COVID-19. And finally, an investigation also opened yesterday into the Schooner Memory Care Center in Auburn, where we are aware of 5 cases. Finally, an update on an outbreak investigation that we have been working with for a few days now at the Oxford Street Shelter, where we are currently aware of 32 cases, 24 of which are among guests of the shelter, 8 of which are among staff members. We've been working, for example, to ensure that there is testing available. Based on the work that we've done, testing is available every single evening at the shelter for residents who are entering or coming back. We are also working to conduct another round of universal PCR testing at the shelter tomorrow. We've also been working, as we have throughout the outbreak investigation, to ensure that those who have been exposed or who have tested positive have a safe place during their period of quarantine or isolation. Turning now to testing. Here's where we stand with respect to testing metrics in the state. Let's start with PCR. Our PCR positivity rate has come down below 3% now. It currently stands at 2.95% on a 7-day rolling average basis. Our volume of PCR testing remains at a high level, right now standing at 701 PCR tests for every 100,000 people in Maine. We've seen similar declines in our antigen testing positivity rate, which now stands at 4.86% on a 7-day basis, with a volume of 140 antigen tests for every 100,000 people. And finally, an update on where we stand with our numbers around vaccination efforts. As of this morning, 167,111 doses of COVID-19 vaccine had been administered across the state of Maine. Of those, 123,683 are first doses of COVID vaccine, and 43,428 are second doses of COVID-19 vaccination. We are also about to enter our orders for vaccine allocations that would be coming into the state of Maine for next week. Again, the word order is not exactly right. What we are doing is ordering the maximum amount that is allocated to the state. So it's less of an order and more of a request to Operation Warp Speed of where we would like those doses to be going across the state of Maine. That order, in quotes, will be put in tomorrow morning, throughout the afternoon and into the night by tomorrow morning's deadline for delivery next week. That order comprises 21,475 first doses of vaccine coming into the state, 8,775 of which are for the Pfizer vaccine, 12,700 of which are for the Moderna vaccine. That does represent an increase of 1,100 new first doses of Moderna vaccine that we anticipate coming into the state next week. So with that concludes my update. Governor Mills, I'd like to turn things over to you, please. And Governor, could I ask you to.
Thank you, Dr. Shah. I don't have any special announcements to make today, but I want to thank Commissioner Lambrew and Dr. Shah for their 24/7 attention to this pandemic over the last more than 10 months, actually about 12 months now since we first heard about this and recognized the dangers inherent in this pandemic that gradually seeped into the state of Maine. The improving metrics that Dr. Shah just mentioned are a good sign. They're an indication that Maine has rounded the corner, we hope, on the post-holiday surge of COVID-19 that we saw, a surge that seemed to follow on the heels of holiday gatherings and the onset of cold weather. The news is good, but of course this pandemic is far from over. As we continue to get shots into the arms of as many people as quickly and efficiently as possible, it's crucial that Maine people obviously continue to wear masks, watch their distance, avoid gatherings, wash their hands. I don't know anybody, for instance, who doesn't love a Super Bowl party, and with Super Bowl coming up, I wanted to talk about that for a minute. I have no favorite on Sunday evening. I'll be very excited to watch the fireworks between Tom Brady making his 10th Super Bowl appearance and the much younger Patrick Mahomes and Kansas City with its superior record of 16 wins and 2 losses. But all that aside, regardless of the odds and the outcome, it's noteworthy to me that the NFL is taking every precaution to avoid letting this Sunday's game become a super spreading event with the COVID-19 virus, maybe scoring extra points. That's why, as tempting as it is to go watch the game at your favorite watering hole or get together at someone else's house, someone with a big screen TV, please don't forget the silent and ever-present danger of COVID-19, which could ruin your game and could even take your life. COVID-19 is not taking Super Bowl Sunday off. In the good news category, last week I got a surprise call from none other than Robert Kraft, owner of the Patriots, inviting me to identify 4 healthcare workers from Maine who would enjoy an all expenses round trip to the Super Bowl with travel on the Patriots jet. This was really exciting news, and we are so grateful for the generosity of the New England Patriots and the Kraft family. 4 healthcare superheroes who have been fully vaccinated, that was one of the conditions, and waiting a week after the second vaccination. They will attend the game Sunday in Tampa. I want to personally congratulate Joe Looper, an emergency department nurse at Mercy Hospital. Joe is also a member of the National Guard who served in both Iraq and Afghanistan. Kathy Bean, manager of clinical and community health services, Northern Light Home Care and Hospice, who has helped set up testing sites for vulnerable populations. And she is now developing vaccination sites. Lisa Ireland, who's an RN at River Ridge Center, who is on the front lines of this pandemic, serving as an infection prevention and control leader. And Dr. Patrick Keeney, pulmonary physician at Midcoast Hospital, who's both cared for patients there, COVID-19 patients, and served as the font of information, the facility's primary source of information about the virus. He has sometimes worked 6 weeks straight without a break. Well, this special gift from the Patriots and the Kraft family can in no way fully express our gratitude to the thousands of frontline healthcare workers in Maine. All of them, whether physicians, CNAs, nurses, therapists, EMTs, support staff, professionals who comforted patients as they took their last breath, staff who provided a lifeline to critical care patients who were isolated and deprived of contact with loved ones. It is those individuals who spent their days and nights for 10 months straight trying to keep people alive in the ICUs, in nursing facilities, in emergency rooms and ambulances across our state, often putting themselves and their own families at risk. It is those same courageous individuals that we should think about before deciding to have a party Sunday night, or before joining an impromptu crowd to celebrate the winning touchdown, ignoring basic public health precautions. Remember, please, at any party without social distancing and precautions, COVID-19 will certainly be the silent spectator. And now I also want to thank the many healthcare professionals who are providing their precious time on duty and off duty, some of them coming out of retirement and volunteering in our new mass vaccination clinics, just getting off the ground in Scarborough and Bangor right now, more to come. All of them giving a shot of hope to communities all across Maine. Dr. Shah says every day, he says, we've got to be patient. We got to be patient. Follow all the health precautions. This is far from over. At the same time, the excitement is too contagious. And the sighs of anticipation and relief are everywhere. They're palpable. So I hope that you'll join me today and every day in honoring all of our healthcare heroes. Let's honor them and protect them and ease their burden by watching Sunday's game safely at home instead of hosting or attending a party where COVID-19 can spread. It's a small inconvenience, a small sacrifice to make for a lot of good reasons this year. Let's all make sure we're alive and well next year to watch Tom Brady's 11th appearance at the Super Bowl. And remember, COVID-19 doesn't care who you're rooting for, so please wear your mask, watch your distance, wash your hands. Thank you, Dr. Shah and Commissioner Lambrew, who's also here, part of our very own Super Bowl team of advisors and consultants and cabinet members. And I'd be happy to answer questions. Thank you.
Thank you very much, Governor Mills. First up is Bob Evans from News Center.
Good afternoon. We are now hearing that a third mass vaccination site is expected to open in Sanford in mid-February. How many of these mass clinics are you expecting in Maine? And could we, like the governor mentioned, soon be turning a corner because of these clinics?
Sure. Governor, I'm happy to start that off if you'd like to, unless you'd like to.
It's something we've been discussing, and I didn't know Commissioner Lambrew might want to weigh in too. I know she's been talking to people in Sanford.
Sure. So, Bob, we are planning for additional sites, one of which will hopefully be in and around the Sanford area to make sure that in York County there is sufficient access to vaccine. We know that York County is about 16% of our state's population, and we want to make sure that there is access to the vaccine commensurate with that population. But we're not stopping there. We know that there are other places in the state of Maine where there is equivalent need to having large throughput, high volume vaccination sites. So in other metropolitan areas, namely in the Lewiston, Auburn area, in and around the Augusta area, and of course in Portland as well. So we're looking at additional locations. Beyond that, the answer is how many more sites do we need in order to make sure we are on pace to be able to continue using all the vaccine that's coming in the state? That is really what governs how many more additional sites we need. We believe that the addition of these sites will help us continue to use what we anticipate being a higher volume of vaccine. If that volume of vaccine that's coming into the state goes up even more, we'll make sure we've got the production, the throughput capacity to use it. Bottom line there is we still need more vaccine coming into the state. When that starts happening, we'll be ready to administer it.
And it is too early to say we're turning a corner, but we are close to saying 1 in 10 Maine residents have had their first doses. Over 20% of older Mainers, people ages 70 and older, have had their first doses. And Maine ranks 6th among states in the nation in terms of the percent of its population that has had a second dose. So we are making some progress to the point at which now, with some predictability about our vaccine supply over the next 3 weeks, we anticipate that we might be getting close to 2/3 of people ages 70 and older being able to be vaccinated by the first week in May. We do anticipate that we're getting close to that point where we can then turn to people ages 65 to 69, which is the next group in our effort to prioritize people who are at most risk of sickness and death due to COVID-19. So we are making progress, but it's probably too early to say we're turning a corner.
Okay. And Dr. Shah, as the governor mentioned, the big game is this weekend. Are you concerned about Super Bowl parties? And if so, is there any new advice for people in bars and restaurants who can now be open later that are holding parties?
Well, Bob, I share the governor's concern, and I agree with everything that she outlined. There is a concern that Super Bowl events could turn into transmission events of any sort. And so I do share that concern for those who are celebrating or watching the game, no matter what the venue is, whether it's at home with friends or at a bar or at a restaurant. The same things we've talked about still apply. Wearing a mask, staying distant from one another, so on and so forth. I know that's hard to do when you're at a bar. It's obvious, but it's really important. So I absolutely share the governor's concern and underscore that. If you can stay home to watch the game and have a simultaneous Zoom call going with your friends, that is by far the safer way to go.
And our guidance is still in effect for those licensed establishments, those commercial entities. They're still subject to all the guidelines from the Department of Economic and Community Development and the BABLO licensing facilities about masking and about distancing, sanitizing, and all those things. They're still in effect no matter what hour you're gathering somewhere.
Thank you all.
Thanks, Bob. I'm going to turn to Marissa, WGME, next.
Hi, Dr. Shah. I wanted to follow back on the Sanford site. Do you guys have any more specifics right now as far as a timeline on that, or any more specific of a location?
We are still working with county officials in and around York County, as well as city officials in and around Sanford, to finalize all those details, both on the location as well as the timeline, Marissa. The timeline is as fast as we can make it happen. I want everyone to know that our team down in York County and our large-scale vaccination team have this as one of their top, if not their top priority. So the timeline is as quickly as possible. In terms of the site location, until all the details are finally worked out, I'm going to hold off on discussing the site. I want to make sure that we don't jinx anything, but hopefully that will be done very, very soon.
And one other question for you, Dr. Shah. The vaccine rollout has certainly evolved over time. We're still getting a lot of questions from people about the whole process. One of our viewers is asking us, given the high demand and the limited supply of the vaccine, maybe you can just address, why didn't the state start with, say, people 80 plus and then move on to 75 plus and so on and so on?
Sure, I can start, and then Governor, if you want to weigh in, the Marissa, that question can be extended in so many different ways. Why not start with 90 plus? Right. So the answer comes down to the following. When we look at the data, what we look for is an inflection point, a change in the curve based on age that for things like, unfortunately, death and severe illness. And what we've done is taken a look at the data to see where in Maine, where that inflection point happens, where there's a rapid change in the curve for things like death from COVID or severe illness from COVID. And that's the point at which you really want to start. And when we take a look at the data in Maine, you see that start happens at age 70 and above. And that's why we started an analytic point there. The other thing to think about as well, though, is that although you certainly want to get to vaccinate folks who are at the highest risk of death or severe disease, we also want to make sure that we are not creating a net that is so small that others might have to wait a little bit longer. So when we looked at those two things, balancing who is at the highest risk from having a large pool of people so we can get to this high throughput we're starting to see, we found that 70 was the right balance of all those factors. It won't be the only place. As the commissioner noted, once we have moved a sufficient way through that 70 and over category, we look forward to being able to broaden it even more. But that age cutoff of 70 was where we started seeing the worst health impacts of COVID-19 start to take hold.
Well said, Dr. Shah, and I don't think I can add to that other than we had these robust discussions. We've had them over time. We continue to have them. And that is where we landed as a group and where I decided that that cutoff was appropriate. The question I kept asking myself, and I think we all keep asking ourselves, is who is it who's more likely to suffer and to even die if they don't get vaccinated? And that's where we came down.
Thanks, Marissa. Let me turn it over to Patrick Whittle next.
Thank you very much, and happy Thursday. If you're in a position to provide one, do you have the ability to sort of provide kind of an update on where we stand with respect to pediatric immunizations for COVID-19? Because I think we have a sort of a broad idea that they're farther in the future, but that's more or less all we know at the moment.
So Patrick, yes, you're right. It is further in the future. Here's what I can tell you. The so-called bridge studies that are being conducted to verify the safety and efficacy of the vaccines within children age either 16 and below for the Pfizer vaccine, and 18 and below for the Moderna. I'm sorry, I got that wrong. 16 and below for Moderna, 18 and below for Pfizer. Those studies have largely been fully enrolled at the national level. And from what I have been briefed on, it will take those studies several months to have generated enough data so that they've seen enough numbers of events to be sure of the safety and efficacy. So based on the briefings that I've had the privilege of taking part in at the US CDC, as well as the Advisory Committee on Immunization, the latest that we've been told is that it will be several months.
And what age range is that for?
I have to go back and check the notes or the slides from the presentation. Right. I don't want to misspeak, Patrick. I don't remember what the lower boundary age was.
I see. Mm-hmm. And are there plans to eventually, in the future, incorporate those younger ages into the mass sites or into the clinics?
The answer is yes. As we've done our models and projections for what type of throughput we need to be achieving and how that throughput would need to be distributed across the state, we have taken into account not just those adults in Maine, 18 and older, but we've included in our models the assumption that at some point, if the studies and the scientific data support it, those under the age of 18 and 16 would also have to be, or would also be vaccinated. And so we've taken that into account in our throughput and analytic projections as well. And they would be folded into the same processes that we're setting up right now, from a scheduling identification and vaccination perspective. They may be further down the line, thankfully, given the relatively lower risk of suffering from ill effects of COVID amongst children. So it may even be further after the FDA signs off on it. It may be later on, even after that period.
Okay, good to know. And one final thing, is there any kind of updated calculus on when we might enter the subsequent phases that we're in now, when we might get into 1C and phase 2? Do we have any kind of clearer picture of when that is coming? And I'll turn it back over to you. Go Buccaneers.
Bottom line answer, Patrick, not at this time, and that is purely a function of not knowing what the production and supply of vaccine looks like beyond 2 or 3 weeks at this point. You know, we still have around about 100,000 or so individuals just over the 70 and over. Actually, I need to verify that number. Don't quote me on that number. We still have a very significantly large number of individuals just over 70 who we are still aiming to vaccinate very soon, to say nothing of those Mainers who are 60 and over, so on and so forth. So before we're thinking about 1C or phase 2, what drives all of that is the supply of vaccine that's coming into the state. That, you know, supply is what governs speed at this point. What we want to do is just set up a really strong, robust system so that when the vaccine supply increases, we're ready to get those shots into arms.
Okay, thank you.
Yep. Let me turn it over to Amy Brown next.
Thank you, Dr. Shah. Patrick was just asking what I was going to ask, but I have slightly different take on it. And first, I wanted to make sure that Commissioner Lambrew, that I heard you correctly. Were you saying that about 2/3 of those 70 and older would likely be vaccinated by the first week in May if we remain on pace?
Let me say it differently, that with the number of people aged 70 and older who've already been vaccinated, which is about 20%, we have a remainder. And if we look at the vaccine supply that the Biden administration says we'll get this week and the next 3 weeks, for the next month, we should have enough supply to get through 2/3 of people ages 70 and older by that first weekend in March, not May.
In March, okay.
And by the time we get to that first week in March, we hope to be able to begin that 65 to 69-year-old population. I think Governor Mills has quite clearly articulated why we're starting with older Mainers.
Great, thanks for clarifying that. My audio wasn't great. And just following up on what Patrick was saying, is that sort of a rough target percentage that you'd like to reach moving into the next phase, and also looking forward to subsequent phases? Will there be a percentage of phase, second part of 1B, that is your target before opening up to 1C, or are things more fluid than that?
We don't have any hard and fast triggers here. We really are trying to make sure that we have overlap. So as we're finishing one group, we're beginning another, to make sure that there's never a gap in different parts of the state. But I don't know, Governor, do you want to add to that?
No, I mean, I just wish there were a slide rule we could use and be more definitive on how much we were going to get when and what we would do with it. We're still finishing up 1A too. We're still doing some healthcare providers and healthcare staff too. And there's the nursing home and long-term care and assisted living segment as well. That's still going on.
Great, thank you. Dr. Shah, we've been talking a lot about
fluid.
Oh, I'm sorry. What was that? Okay, didn't mean to talk over you. Sorry about that. Dr. Shah, we've been talking a lot about vaccines, but not about treatments much lately. Is there any promising news on the horizon regarding any treatments?
Nothing new or significant, Amy. I know that there are more studies coming out about the value and upon which patients to use the existing treatments we have, some of these so-called monoclonal antibodies, as well as additional data supporting the use of remdesivir. But to your question around anything new on the horizon, nothing at this time.
Thank you.
I know that there is a lot of research underway, but nothing new that's coming our way to any of the states at this time.
Okay, great. Oh, and one more thing, any update on the outbreak at Crossroads to Calvary Church in Morrill?
No, nothing significant to report there, Amy. I will get you the latest updated numbers on where that stands, but no significant news there. The number, I just grabbed it from my notes, is 23 individuals as of right now.
Thank you.
Let me turn it over to Brian Sullivan next.
Thank you, Dr. Shah. Governor Mills, I would just wonder if you could give us any perspective on the dealings that you've had with the Biden administration. I think it'd be very interesting to know if you'd heard anything about production of future vaccines and when it might be distributed, things of that nature.
Certainly, I've had some very productive calls with the administration. They were both forthright and factual, very crisp. We had a good dialogue with the CDC director, Walensky, with Jeff Zients, with other members of the administration, with General Perna, who's remained in office to help with the distribution of the vaccine, and all good professional individuals. We had a great discussion just the other day, I think Tuesday, during the snowstorm, about increasing production and what they're doing there. That's when we got the news about an additional 5% coming our way. Plus over and above the 16% that they committed to last week at this time. And so that's a significant increase. Obviously not enough, it's never enough, but they're doing everything they can and using the Defense Production Act to good use, putting that to good use, and also answering questions very forthrightly, telling us what they can and what they can't do as well. The National Guard also, they reported to us that they're going to reimburse us for FEMA expenses 100% retroactive to last January 20th of 2020. That was all good news. We talked about the reporting of the pharmacy data. We talked about equity and why equity is not a platitude nor an afterthought, but is something very real that we have to address in the pandemic and with respect to vaccinations as well. We talked about the supply, but that was all good news. Additional Pfizer doses. We talked about the pharmacies and the rollout of that new program to pharmacies, which is another 10% nationwide of production of the various vaccines. So, we've had good forthright discussions. I'm very pleased with the tenor and content of those conferences.
But nothing concrete as to when more of the vaccines may be done being produced or becoming more available?
Well, the concrete information we got just on Tuesday was an additional 5% over the 16% of last week for the coming 3 weeks. That's pretty significant.
Yeah, it certainly is. I was more referencing perhaps what hadn't been produced, things of that nature, that they were working on, and maybe down the line a little farther.
Well, we also talked about the Johnson & Johnson prospects of that. People asked about that. That's not yet in the hands of the FDA. We're looking forward to a quick but efficient and effective review of the Johnson & Johnson vaccine. If it's approved, we look forward to receiving that as well, which would be a big boon. If it's approved, that'll be a one-dose vaccine, and that would be, in addition to what we've already got, which would be very, logistically favorable.
Okay, Dr. Shah, if I could ask you about the doses that Maine has received so far. Of the 167,000 that have been given out, how many additionally has the state received thus far?
I'm sorry, say that again, Brian. I just want to make sure I understand your question.
So 167,000 doses have been given out, correct?
Yes.
That is right. I'm just going to my, that is correct, 167,000.
How many are there more than that, and where are those? Are those second doses, or are those doses that are going to pharmacies, things of that nature? Can you just explain that to me a little bit?
Yep. So that includes, that 167,000 is total shots in arms. That includes a mixture of first and second doses, specifically about 123,000 first doses, 43,000 second doses. Brian, I think the question you're sort of asking is of the doses available to us, that is to say, apart from the long-term care partnership, what percentage of those has Maine used? It's been a couple of days since I looked at that number. It was in the 80% range when I looked at it a couple of days ago. We are working now that we have higher throughput sites online to make sure that as doses come into the state, as many of them are used as possible.
Thank you.
Let me turn it over to Megan at WMTW next.
For taking my question. So we heard from the US CDC yesterday, I believe, that increasing data shows that the safe reopening of schools does not imply that teachers need to be vaccinated. So in order to reopen safely, it doesn't require teacher vaccination. But last week, Portland High School completely shut down schools 10, 11, 12th grade contingent on teachers being vaccinated. So I'm curious, which one does the state endorse? Which philosophy does the state endorse? The US CDC guidelines or vaccinating teachers before we reopen?
Let me jump in and say, obviously teachers should be vaccinated. We hope all people will be vaccinated as soon as possible. I can't speak for Superintendent Batana or any of the people in Portland who were party to that decision, but we do have local control in Maine, and every school district is run with its own local school boards and school committees. And we don't dictate to them what they should do in that kind of detail. But I will say in my conversation with CDC Director Walensky just the other day, she said, look, on school reopening, so we discussed that, she said, K through 12 schools should be the last to close and first to reopen, quote unquote. School settings do not result in a high rate of transmission when precautions and mitigation measures are carefully followed. That's what she told us on the phone, and I think that's what she also said to the general public in her press releases. So that seems pretty authoritative to me, that schools, and we have set out our own criteria for schools to keep in place on distancing and masking and whatnot. The schools presumably are all following those precautions, and I think their relative safety has been acknowledged. I think, to me, one of the biggest challenges of this pandemic is losing kids. Losing them out of the classroom, and those who can't work remotely or can't study remotely or don't have access, we're losing those kids. And the sooner we can get them back into school, the better. However, we have to do that.
Would that entail moving teachers higher in a higher priority group if vaccination is important in keeping them safe?
That's a question. What I just quoted from Director Walensky was, school settings are relatively safe. They do not result in high rates of transmission when precautions, mitigation measures are followed.
So it's up to the individual school districts to decide.
Well, what we have done is, set out color zones, yellow, green, red, determined by what the rate of spread is, what the case numbers are in that particular area. And then school districts follow their own dictates about what to open, when to open, how to open. But I hope that every kid gets a chance to be back in the classroom as soon as possible. We have tried, for instance, one of the things we did last fall with the CRF money was to try to allow teachers to teach into the classroom remotely. So you'd have the kids in the classroom, the teacher who might have some vulnerabilities could teach remotely into the classroom. And we would have teaching facilitators, which we have trained. The community colleges have stood up a training program for these facilitators to be in the courtroom and help channel the curriculum to the students. That's one way to address it when teachers are unable to physically come into the classroom.
I would assume that if schools did reopen, the existing rule of having to keep kids separated, I mean, would that even be possible to continue if the rules that right now when kids are in school that they have to separate and they have to be a certain distance apart? would schools even have enough room to be able to keep those rules in place and have them back in school?
Megan, schools are doing that right now. They're doing it all over the state.
Okay.
Great. Thanks, Megan. Let me turn it over to Patty White next.
Thanks, Dr. Shah. Do you have any more information about how many doses we're getting for the new pharmacy program to vaccinate the community and which pharmacies are participating?
The answer is no. We don't have the information on that, and we were hoping that we would. I've pressed for the exact number of doses that would be allocated to the state of Maine. We understand that at the national level, it is approximately 1 million doses nationwide. And I know that the US CDC is working very hard to provide states the exact number that will be coming into Maine. And as soon as we have, I was hoping we would have that today so we could talk about it today, but I don't have that number right now. We understand that they are working on it, and hopefully we'll have it really soon.
Okay. And you also mentioned on Tuesday that you would be transferring doses from CVS and Walgreens in the long-term care facility program to independent pharmacies. Can you tell us how many doses and why?
The why I can definitely tell you. The how many, we are still working on that analysis. The why is simply what we've done throughout the vaccination, and I say that as if it's been months and months and months, but what we've done since week 1, 8 weeks ago, is we look for 3 things that are going on. We look for vaccines, we look for vaccinators, and we look for those who would like to be vaccinated. And anytime we see a mismatch in between those things, if we see a lot of vaccines somewhere with able vaccinators and arms to get them into, we balance things over. We load balance across the state. And right now, we have excess doses that are in the warehouse at both the Walgreens and CVS pharmacies. And we also have independent pharmacies in Maine that have stepped up in spades to say, we will help out that program to get residents and staff of long-term care facilities fully vaccinated. So we are working with those independent pharmacies to get them scheduled. The reason I don't have a number for you right now is we want to get a sense of schedules, and then we can make the allocations happen. I don't want to just sort of blindly say, we're going to take X number of doses and move them over without knowing that independent pharmacies can actually go in and have a date on the calendar. If I do that, then I haven't actually solved the problem. So I want to connect all the dots before we make those transfers official. I know that the team is working on it. I think we'll probably have all of that analysis wrapped up within the next day or so.
Okay. And can you just say, I mean, this is an issue that's been going on for a while now. I mean, why hasn't it improved, I guess? Do you have a sense for why there's still this issue with CVS and Walgreens?
I don't have a great sense. I'm not sure. I was hoping to see that the early progress they made would continue to accelerate. But we are fortunate in Maine to have a dedicated cadre of independent pharmacists who have said, we will help round this program out. The other thing that has changed is that the US CDC just a few days ago officially blessed states making these moves from the unallocated doses. So that makes it administratively easier for us to do that. That's why we're doing it now.
Thanks.
I can't answer any better than that, except to say that this is an issue that's been brought up on the national calls. It's not unique to Maine at all. A lot of the governors, almost all the governors are seeing some of the same problems with the 2 pharmacy issues.
Thank you.
Thank you, Patty. Let me turn it over to Evan at the Maine Beacon next.
Hi, Dr. Shah. Thank you. This question is for Governor Mills. I was wondering what your perspective is on the negotiations around the federal pandemic relief that the Biden administration has advanced, and reactions from members of Congress. For example, Senator Collins recently said that she favored aid for municipalities, but expressed skepticism about additional funding for states, something that you've previously identified as a priority. So just wondering if you've had any conversations with Senator Collins about that and what you think is currently most important to include in a federal relief package when it comes to Mainers.
Oh boy, that's a pretty open-ended, am I on? Yeah, that's a pretty open-ended question, Kevin. Thank you for that, except that I have frequent communications of various sorts with Senator King, Senator Collins, and as well as Congresswoman Pingree and Congressman Golden about a number of things. I don't have a specific position on what should be in either the Biden plan or the 10-person bipartisan plan or the Republican plan. Far be it for me to delve into that at this point. I know there are a lot of needs out there, and unemployment is obviously a need to help the people who are unemployed. Food and housing are needs that people are desperate for. Relief monies for education to help make sure schools can open and open safely is a big need. Money for the states for those states, most of them have income taxes. When the federal government creates a tax exemption or a new deduction or new tax relief, it's easy for them, the federal government, to say the federal government will waive taxes on that. When we go to try and enact conformity with that, we have a hole in our budget, or potentially a hole in our budget. So I hope that the next package they do produce will at least have enough money to compensate the states for those kinds of measures they took in December and that they may take in the future. That would help us sustain our basic vital services for healthcare, for the public health infrastructure, for education and public safety within the confines of our balanced state budget.
Thank you. And then just another question I had, a group of nurses at Maine Medical Center, which is the state's largest hospital, are currently working to form a union. And I'm wondering if you support this union organizing drive and if you have any message for the nurses.
I'm not at all involved in the unionizing drive by the nurses at Maine Health, and I wouldn't dare offer an opinion because I really don't know enough about it, and I don't think it's my place to tell them what they should or shouldn't do.
Thank you.
Let me turn it over to Jessica Piper next.
Thank you, Dr. Shah. First off, I wanted to ask about the federally qualified health centers. Some of them have been taking a different approach by internally prioritizing people of color and patients with comorbidities. Would you like to see that approach adopted by bigger institutions? And are these facilities becoming more integral to the state's equity efforts?
Sure. Let me start with the latter, which is they have been integral to our equity work during COVID, before COVID, and now with respect to vaccination work. Indeed, this current week, we allocated roughly 1,000 shots to a certain number of FQHCs. We're increasing that for next week because we know that they play a vital role in their community. They're trusted, they're easier to access for many people. So we continue to look forward and thank our colleagues at FQHCs for the work that they've done. Commissioner, sorry, I think I cut you off, Commissioner, so I apologize for that, but I'll turn it over to you.
I will just add that our understanding, though, is what they're doing is making those prioritizations within age groups. So our understanding is, for example, Penobscot County Health Center is prioritizing people of color over age 70. These hard to reach populations over age 70 is their way of triaging within their patient population. But we have said from the governor on down that right now we're at a point where we're not yet to younger people, we're not yet to people with comorbidities, we're not over the age of 70, but we welcome within that over age 70 group trying to get to those people who are otherwise disadvantaged. So we welcome efforts like that.
Mm-hmm. I will say, Jessica, yesterday morning I met with some healthcare leaders from in and around the Penobscot County area, and on that call were leadership of some FQHCs, and they talked to me about the work that they're doing, and I commend them for taking that both equity and velocity focused approach. My recommendation was that they not let the focus on finding the highest, most vulnerable folks slow down the overall effort. I think we can do both. We can focus on those who are at the highest risk, for example, with the cutoff of age 70 and over, and also vaccinate folks with velocity.
All right, thank you. And then I wanted to follow up about this schools question. I was wondering, are educators going to be vaccinated under frontline workers as part of phase 1B whenever we get there? And has the state made any specific plans around what it might look like to vaccinate them?
I'm sorry, the question is about educators again?
Yes, has the state made specific plans around vaccinating educators, and are they going to be under part of phase 1B?
No, we have not made specific plans.
Is there a timeline for when those plans might get decided? Like what information is the state waiting on?
No, I feel like we're in an echo chamber because we keep saying it all depends on supply, but it all does depend on supply when other segments of the population can get vaccinated beyond the most vulnerable people by age group, and then hopefully people with comorbid conditions yet to be fully described, identified, but we're looking for the people who are more likely to suffer and die if they don't get vaccinated. Right now, that's people sick. We haven't gone beyond that.
So there haven't been any decisions about who counts as a frontline worker under the phase 1B frontline workers or the phase 1C essential workers.
No, and you know, I've absolutely avoided the whole phrase, who's an essential worker, because I think everyone is essential. No one segment of the population is more important, more vital to the workings of our commerce, of our society, than other segments of the population. Teachers are very highly valued, of course, and our schools are very obviously an integral part of our society. But we have not designated sectors or groups of people other than the ones already identified.
And the final question for the afternoon goes to Sam Shepard.
Thank you, Dr. Shah. On Tuesday, you said you hadn't spoken to anyone at Maine General following the reporting about donors gaining privileged access to a pilot program of theirs for the vaccine. I just wanted to know if that was still the case, and if you still haven't spoken to them, sort of a two-parter here, sorry, why you haven't, since equity is a core tenet of the vaccine rollout.
Well,
So
yeah, go ahead.
I'll answer that question because having seen the report, we did raise concerns. I have been in communication with the leadership at Maine General about the fact that it is not consistent with the state's approach to vaccination to selectively vaccinate people. We made it perfectly clear that that is contrary to our policy and got assurances that that would not be the practice going forward.
And Sam, just for the record, I don't think you captured what I said correctly or accurately. Those concerns were noted to us, and we did in fact communicate them to Maine General. I had not spoken with anyone subsequent to the publication, but certainly beforehand we have.
Okay. And second question, once the vaccination categories are expanded, does the CDC plan on having a centralized call line for older Mainers who may not be the most internet savvy to give them a chance to schedule appointments and get questions answered that way?
The answer is yes, Sam. In recognition of the fact that internet access is not uniform across the state, as well as navigating some of the online forums not being the easiest thing for anybody to do, particularly older Mainers, we are working to set up a centralized call number or call center where folks can call in and get scheduled in the same manner using the same access points that they would if they were using the online tool.
Okay, thank you.
Governor, that was the last question for the afternoon. And so I will turn things back over to you if your internet connection is ready to go. We'll come back to Governor Mills in just a second, but while we do, I wanted to just take a moment to underscore what the governor noted at the top. One of the things we've seen throughout the course of the pandemic is that small gatherings, as well as large gatherings, can generate opportunities for spread. So I want to underscore what the governor said at the top of today's briefing, which is to exercise caution. You can watch the Super Bowl with just your family, just those in your household this weekend. That is the smartest and safest choice. Governor, I'd like to turn things over to you to round us out this afternoon.
Thank you. Of course, I have an unstable internet connection. I'm only in the state capitol, but can't rely on that. No, I just want to say congratulations again and best wishes to Joe Looper, Kathy Bean, Lisa Ireland, and Dr. Patrick Keeney. Have a great time at the Super Bowl. I wish I could be there with you, but you know, I'll be home watching it on TV. We'll look for you in that audience. And thank you all. Have a great weekend.
Thank you, everyone.